Walking is highly regarded as an excellent exercise for knee arthritis by healthcare professionals because of the medical research we have on knee arthritis and walking. But what if you're walking for exercise and your knee starts to become more swollen, starts to hurt you throughout the day, it wakes you up at night, and overall you feel like your knee is just not getting better? In this video today, I'm going to give you my 3 M's framework on how to make walking constructive rather than destructive for your knee health. The first M in this framework is moment tolerance is key. And what I mean by this is your tolerance, your ability to do walking based on your knee health right now at this moment is going to be a certain level. You're going to have a certain threshold of what you can tolerate right now. And it's going to change as you improve your knee health. It's going to go up. You're going to be able to tolerate more walking, or maybe more intense walking, like walking faster or walking while carrying something. As you flare up, if you flare up or if you don't exercise enough and move your knee health in the right direction, then your walking tolerance, the moment tolerance that you have, is going to go down. Or it could be that you have excellent tolerance today and maybe you did a lot of walking earlier in the day, and now later on in the day, if you have to do even more walking, it's going to not feel good because your moment tolerance then is lower. So you have to think of this as what can you tolerate right now, today, at this moment, based on all the things you've been doing lately, in the past day, in the past hours, or even in the past few weeks or months. All of this needs to accumulate into how you feel right now. And so moment by moment, you need to be thinking, should I be walking right now? Do I need to take a break? Do I need to just call it for today and not be on my feet? Because if you push through it, if you have that thinking in your head that doesn't apply here, that no pain, no gain thinking, you're going to make it worse. And this is so common in the healthcare industry because we have medical research, tons of medical research that connects walking to an improvement in knee arthritis. And healthcare providers all around see this research. They get taught this research in school, and so that they treat it as gospel. This is what we should be doing with all our knee arthritis patients. So it's very common that you might go to a physical therapy office with your knee arthritis problem, and they might say, go get on the treadmill because walking is excellent for you. And meanwhile, you're on there and your knee's just throbbing and hurting, and you know you're going to pay for it later on, and you're not going to be able to walk for the next couple of days. But you might have somebody confidently crossing their arms and saying, there's research on this. Walking is good for you. You need to be walking. Sorry it hurts, push through. And that's not how we should approach this. Your tolerance in that moment, if you're hurting, is low, and you should stop walking at that time. We don't have solid research, medical research talking about this. It's incomplete at this time. It's in development. I don't even know if anybody's researching that idea of how much can you tolerate right now with walking. But this is why it's one of my 3 M's in this framework is moment tolerance is key. You need to be reading yourself and what your knee is telling you and stop if it's too much. And the way that you know it's too much is because it's starting to hurt you. You know, because you've probably flared yourself up many times. You know that sensation you get, that extra pressure buildup in your knee, that discomfort, or maybe for you, you get more popping and clicking. Maybe there's like a heat sensation you get. Everybody's experience is a little bit different, but once you tune in to what you're feeling in your knee, then you can start to get ahead of it and start taking breaks, start planning better, and don't walk too much so that you flare your knee up and you're just trashed for the rest of today and then maybe even the next few days if you really overdo it. The second M in the 3 M's framework is muscle strength matters. And when we're talking about specific muscle strength, I'm talking about the glutes. And this isn't talked about a lot. In fact, what the research tends to focus on when we're connecting knee arthritis and an improvement in walking is they're looking at quad strength, or muscles in the front of the knee. Sometimes they'll call it knee extensor strength. They're looking at the muscles that straighten out your knee because the assumption here that nobody's talking about, but everybody assumes, is that the quads are the main muscles that you're supposed to be using whenever you're walking. And so they even have researched quad strength levels. There's ways to measure strength in muscles with a correlation. They found that there's a correlation between weakness in the quads and increased knee arthritis. And you have to understand that a correlation, that word just means that as one thing is happening, in this case, as strength is going down in the quads, then another thing also happens. In this case, they're talking about knee arthritis going up, or they should go this way. They should have intersecting lines that go this way, like that. So as knee arthritis pain goes up, or progresses or worsens, and quad strength goes down. And what people are doing, what healthcare professionals are doing with this knowledge, with this research, is they're saying, oh, if you have knee arthritis and you have weak quads, and so therefore you need to strengthen your quads to help the knee arthritis. And it may actually help in the short term. But here's my problem with this. Here's why I don't think you should be strengthening your quads and why the muscles matter, specific muscles matter. If you have had knee osteoarthritis for months, let's say you've been in pain for months or longer, years, but even if it's just been bothering you on a consistent basis for months, then you're probably not walking much and you're probably not exercising much because it hurts. It just hurts to do stuff. So what happens when you don't exercise much? Strength goes down. So is it that surprising that people that have worse knee arthritis have weaker quads? No, it kind of makes sense. But I don't think it's right to say that the lower strength in the quad muscles is the cause of knee arthritis. By definition, correlation, that word correlation leaves out that it's the cause. It's just things that we see happening together. But determining the cause of knee arthritis, we don't have that information. It's not available. We haven't progressed, advanced that far in the research to have a direct cause. Surgeons don't know the cause of knee arthritis. Physicians don't know the cause. The medical field at large does not know the cause. All we have is correlations. So now what I talk about on my channel at length is how it's glutes. Glute muscles on the back of the hip are the cause, weak glute muscles are the cause of knee arthritis very often. And the way that I can confidently tell you this is because we've had so many people go through our knee arthritis recovery program, and on our channel that never joined our program, where I heavily drill everyone on getting stronger glutes. And it's not just getting stronger glutes, it's about knowing when to use the muscles too. There's more on that later. But when you get stronger glutes, it takes the pressure off the quads, which takes the pressure off the knee joint. So really, and it's my strong belief, and there's no medical research on this yet, we're not that advanced in the healthcare industry. It's my strong belief that the cause of knee arthritis is long-term excessive pressure, more than what the body can tolerate, in the amount of time that you give it in the knee joint. And that pressure is fed by overused quad muscles on the front of the thigh. And so as you walk more and you don't have strength in the right muscles, because that's the second M, is muscle strength matters. If you have an imbalance of strength and you're using your quads on the front of the thigh too much, and you don't have good strength in the glutes, then you're going to overload the knee joint too much, because those quads are going to cause a lot of force generation, more than they should, because they're compensating for weakness back here. And that's going to set you up for not good pressure in the knee, which is going to cause more pain in the knee joint. So there's a study that I need to tell you about. Let me just read you the title here, because you can look this up. It's called The Effects of Physical Activity in Hip and Knee Osteoarthritis, a Systematic Umbrella Review. And the key takeaway that I want you to understand with this, they measured walking steps, like you could do with a pedometer or with a smartwatch or a smartphone or something like that. You can measure your steps in a day. And what they found is that people that walk less than 10,000 steps a day don't have any progression or worsening in their knee arthritis. Good. So that means that they can walk and feel good. And usually walking is associated with weight loss and feeling good in other aspects meant for your mental health and so many other things in your body, your cardiovascular health. Walking is an excellent thing for your overall health. But here's the kicker. If you have arthritis and you're walking beyond 10,000 steps, then it's likely to progress your knee arthritis. Those people are going to have a progression in their knee arthritis. That's what they found in this systematic review. And I think that's pretty landmark. That's pretty important because that's telling us that there's something about walking. When you hit a certain threshold, it's going to make it worse. No information about what muscles are being used and how strong they are. It's just that we know that too much walking can actually make arthritis worse. And there's been other connections like with weight, but there's also where's the cutoff? We don't have a good cutoff on weight, because it's my strong belief that even if you weigh too much, you can still help your knee arthritis tremendously and avoid a knee replacement surgery, even if your knee is bone on bone. But you have to get strength in the right muscles, usually the glutes. There's other ones too, in the feet, in the abs. And healthcare professionals don't know this. They tend to focus on the quads because that's what's touched on in the research. And that's what we've been doing traditionally for years. And if you think about the way that medical professionals are trained, they go through their schooling, their classroom style schooling, and then they usually get placed in internships. Sometimes they call them rotations or clinicals, where they shadow the person that they're going to be doing the job like. So they're going to the student doctor shadowing the doctor that's already been working in the setting for a while. Or same thing with the physical therapists and nurses. They all do the same thing. And so they're inheriting the treatment approach, the knowledge from that person that's been working ahead of them. And so if that doctor has been recommending quad exercises because that's what their mentor recommended and the mentor before them, and what the research says just reinforces this whole loop, you're probably going to get quad exercises. That's how the medical system educationally is set up. And you're also probably going to get told to walk more without any specific instruction on strengthening certain muscle groups like the glutes. Let me tell you the third M, the methods used for walking. The technique, the method, the form. There's all these words to me mean the same thing. The way that you're walking. Nobody really pays attention to that. In all these research studies where they connect improvements in knee arthritis and in your pain and your function to more walking. And in that research study that I just mentioned, where beyond a certain amount of walking, 10,000 steps, which is about 5 miles or so, you start to get a worsening in knee arthritis. Why is that? We don't have that answer. My personal opinion, my professional expert opinion, I think it's because we're not told exactly how to walk. The assumption is that you just know how to walk because you're doing it all the time. But in my knee arthritis recovery program, here on this channel, I talk about walking. And when you fire the right muscles at the right moment in walking on a consistent basis, people have a reduction in knee pain. Some people have an instant reduction in knee pain, where once they figure out how to use their glutes right, and the way to do this, let me just be clear. When you land, when you step on a foot, like let's say you're gonna step on your right foot, once your weight loads onto that foot as you're walking, your glute on that same side, on the right side, should tension up mild to moderately, 20 to 50% for a moment. Because then you're going to take a step with the left foot and put weight on the left side, then the left glute should tension up 20 to 50%, mild to moderate. And this is how walking should occur. You should just be placing your weight on that foot, tensioning that glute, and then doing the same thing on the other side, and you're just essentially alternating glute contractions. The problem that I found as we've helped more and more people with knee arthritis using this treatment approach is that some people can't even fire their glute muscles. This requires that the prerequisite for this is that you have conscious control over that glute muscle, and then that you have enough strength in that glute muscle to be able to overcome your quads taking over because they're probably so strong. This is a detail that the research hasn't touched. And as a result of that, medical professionals are aloof to this. They don't know. And so I don't think anybody out there is trying to hurt you as far as, medical people. I think everybody has good intents for the most part. It's like every other profession. There's good and bad seeds, usually tons more good seeds. But overall, the medical field at large, people go into that field because they want to help you and they're trying to do good by you, and they're sharing their knowledge that they got in school with you from their mentors, but they just don't know this because it's not common knowledge. There's no research on this. But if you can figure out how to walk, the method for your walking, and make this a consistent thing, where 80% of your steps, or said differently, 8 out of 10 steps, are done this way that I described, where you're clenching your glute and then letting it go and just the right amounts, and you're timing it right, if you can do that, most people instantaneously have a reduction in knee pain and can probably walk beyond the 10,000 steps as long as they develop the strength and endurance to do so. The body is an amazing structure. It's one of the only things that I know of on this earth that actually gets better, gets healthier, gets stronger the more wear and tear you put on it, the more work you put it through. But you have to follow the 3 M's. You can't put too much pressure on it. You have to make sure that you're thinking about that moment tolerance. You have to think about the muscle strength in the right muscles, so the weakest muscles have to get stronger. And then you have to also consider the method you're using for walking, the technique. If you're doing these three things in the 3 M's framework, then you're going to be successful at walking. And now you can use walking as a constructive tool, a constructive exercise for you. And especially if you can make it the way that you always walk, even in the little distances you have to do, like within your home, within your workplace, within familiar places that you're just doing chores and everyday activities in. That's the key, because that's probably the majority of your walking. Unless you're on a regimented walking plan where you're going for 30, 40, 50 minutes, hours or two, then you need to be more conscious about how you're walking then. And if you extrapolate this, if you take this out to the next level, if you're hiking, if you decide to go running, because we've had tons of patients that have knee arthritis that are back to running because they're following our 3 M's framework, you're going to be able to do that. You just have to take the pressures off the knee. You have to figure this out. Have you run into this problem where you were told to walk for exercise and then you tried it and just got worse knee pain? If you have, drop a comment below, because this is such a common problem. And then I'd challenge you to go out and try the 3 M's method. And I love it if you can come back and let us know if it helped you out. If you want to see me go through the specifics of how to walk, and I demonstrate everything on how to put your foot down, how to use your glutes, all the details of what you should do when you walk, check out this video. It's called Does Walking Help Knee Pain? And I'll show you all the details so that you can start walking right now and improve your knee health.